think what we're going to do now is each take about 3 minutes to talk briefly about the bills that we may have worked on during the legislative session, and then try to get to some of the audience questions that have been submitted up to this point. There is still an ability to submit questions. If you're in the audience and did not submit questions earlier, there is a link on the YouTube description for you to be able to go to a Google form to submit your question. That is being monitored. So if you have questions, feel free to go ahead and do that. We'll periodically remind folks as well. So I'm Clarence Lamb, Senator District 12, serve as the Senate Chair of the Howard County Delegation, also serve on the Senate Education, Health, and Environmental Affairs Committee, and also serve as the Senate Chair of the Joint Committee on Audits and Evaluations, as well as the Joint Committee on Fair Practices and State Personnel Oversight. During this past legislative session, worked on a lot of healthcare related bills, which is consistent with my background as a physician. I'll touch on a few of these and that may be of interest to the public. One bill that I worked on that I think is a real win for many folks who have a chronic disease called diabetes are currently on insulin. And so insulin is a long-standing medication that has been more or less readily available, has been around for decades, but whose costs has been steadily increasing in spite of the fact that much of it is generic these days. And so we sponsored legislation with Delegate Pena-Melnick in the House to cap insulin at no more than $1 a day for those that are diabetic. And so it's a real win for folks so that they don't have to make some difficult choices between putting food on their table and having the medications that they need. And so we were able to cap that at no more than $30 a month or $1 a day. We're not the first state to do it. And many other states have moved in that direction already, but we think this is a real win for patients. We also sponsored legislation called the Healthy Babies Equity Act that did pass the General Assembly this session, which extends prenatal care for women and their babies before birth as well as up to age 1. And this includes those individuals who may be undocumented as well. We think this is a real win for folks because prenatal care has been shown to be incredibly important for the mother, as well as making sure that the baby gets off to a good start. There are a lot of tests and other screening that takes place during the prenatal period, as well as follow-up care that's needed for babies once they're born. And so this is a real win to make sure that those who may be uninsured or underinsured and need prenatal care and postnatal care up to age 1 can get it. I also sponsored legislation to better protect our local health officers. We've seen many health officers leave during the pandemic. In fact, 7 of the state's 24 health officers have left their positions in the last 2 years over the course of the pandemic. Some of them have left because of rising stress and anxieties. Others have been pushed out because of political reasons. And so legislation that I sponsored this past session will better help protect those local health officers who are really carrying out and implementing the policies of the state health department from being terminated for political reasons. There was also a case over the fall of vaccines that were mishandled by the state health department, and a whistleblower raised the concerns about vaccines that were not kept in proper temperatures or refrigerators or just kept in the back of vehicles. And so I also passed legislation to help better protect whistleblowers who are bringing up concerns about mismanagement at the Maryland Department of Health. I'll close by touching on this. This district is being, the lines for District 12 have changed. And so with the coming election, new lines will be in place. Because of that, we're going to be losing Delegate Ebersol. And it's, bittersweet in many ways because we've served with him, at least Terry and I have served with him for the past going on 8 years now. And it's been a real great team and great working relationship with all of us. And so we're really sad to see him go. We'll touch more on some of the district lines, I'm sure, and some of the questions that come forward or some of the descriptions that come forward as well. But, I just want to personally say thank you to Eric for his service to our community. We will certainly miss him as part of District 12. With that, I think we're going in alphabetical order. So actually, Eric is going next.
Well, it's I'm gonna wipe a little tear out of my eye there for the nice things you said. Yes, the District 12 team has been what I would consider to be. I've always said that we all have different personalities, but the value system that we share has bound us together rather tightly, and I'm going to miss that bond to be sure. I will be running for office strictly in Baltimore County, in a district in Baltimore County that has a number 44A. But as Delegate Hill and Delegate Feldmark and Senator Lamb like to remind me, we all still represent District 12. So I still occasionally see them here in Baltimore County when there are things to be done, and they still see me in Howard County because we are still the delegates and senators from those districts. And so I still see myself as doing that. One of the one of the very great pleasures of getting to be a subcommittee chair in a committee is that you get to deal with other people's bills as well as your own. And sometimes you have a great deal of influence over them. One of the things that we worked on very hard in the committee, subcommittee, which is early childhood, but also handles special needs bills that deal with special needs students, were a variety of bills, but the speaker had pretty much not her own bills, but she had a handful of bills that were referred to as the child care package. And one of them was my own, but others were by Delegate Queen and Delegate Solomon. And they involved a number of different things, and we can talk about them at greater length later if there is interest in them. But they were child care stabilization grant for child cares that are teetering on the edge of going out of business. We have a revolving capital loan program, interest-free loan program for child cares to expand. We extended bonuses to child care workers for the next 2 years, as well as to the child cares that are working, have to spend money in finding them. And we also have a number of students that get scholarships to attend childcare because their families are not of means to be able to do that. We started a bill that starts the procedure for shortening that, what we call presumptive eligibility. If somebody thinks they're eligible, it can take up to a month for them to fill out the form and then for MSDE to vet it. And we are willing to take the risk that they're eligible if they sign a little form that says, hey, I think I'm eligible. This is how much money my family makes in a year. I need some help with childcare. And then we find that in most of the cases, they're actually correct. And we're willing to use our funds and some federal funds in case it doesn't work out. So we're doing a number of things to push childcare. Had a handful of bills. Some of them came through through childcare, and I was able to work them. One's called the Early Childhood Mental Health Consultants. Children that are emotionally difficult or even physically difficult in child cares are not required to keep them around like our schools are to either keep them or find places for them. They can simply, sounds mean, expel them. They don't quite do it like that. They just go to the parent and say, we don't have the wherewithal to deal with them. It's not good for these students, and it's not good for the businesses that want to have students. And so the early child mental health consultants will send someone to a child care to help them with a particular student, or more generally to train staff how to deal with students that have special needs like that. The program exists, but this bill will codify it. I'm waiting for the governor to sign it. It will codify it and commits $3 million a year to the program. So that's a good one. We also worked very hard on, over a number of years, a bill that would significantly reduce and in some cases prohibit restraint and seclusion, especially seclusion, which is basically locking students up in schools. There are some situations where it would exist, but it's much more prohibitive than it was before. So, and the one personal bill that steps away from education for a second is that, following up on a bill I passed a few years ago that requires truckers to get training in recognizing the signs of human trafficking and how to report it. This bill will do that for people who are working in hospitality and hotels and motels as well. And I have a future of transportation hubs coming up on that one someday too. So with that, I'll stop and we'll see if there are other questions. I can talk more about some of those child care bills if we want to drill down on them a bit. Thanks. Let's see, EF. Okay, it sounds like you, Delegate Feldmark.
Thank you. So as I mentioned in my introduction, I serve on the Ways and Means Committee, and a good bit of the legislation that I have sponsored is focused there in the issue areas that committee deals with: education, revenues and tax policy, tax fairness, and election law. So this year, I had success with a few bills that made it through. One was the Inclusive Athletic Attire Act. That is to ensure that student athletes who need to make modifications to a team uniform, either for religious reasons or for modesty, are able to do so as long as it is safe and does not interfere in the sport. So this is a situation that there have been some, in recent years, some problems that have come up. There was a process that students could request permission to make modifications and had to get approval and have documentation with them. This takes that administrative process out of the process and simply codifies the student's right to make needed modifications as long as they are safe and don't interfere in the sport. So, I think we are very well aware of the benefits in terms of both educational benefits, social benefits, leadership development, all of the team building benefits that come out of participating in sports as part of an educational experience. And we want to make sure that that's absolutely as inclusive as possible. So I was very pleased that passed both houses. And another law was actually a local bill for Howard County, focusing on creating a Housing Opportunities Trust Fund. This was a recommendation that came out of the Housing Opportunities Master Plan to create a non-lapsing fund to help support affordable housing expansion in Howard County, which we know is very important given how expensive of a county Howard County is to live in. And that is one of several affordable housing initiatives we've had over the last 4 years, including this year getting a local bond initiative for Patuxent Commons, which is an inclusive affordable housing development that's going to be coming to Columbia in partnership with the Howard County Autism Society, to provide independent living for individuals with disabilities in a supportive, integrated, mixed income community. So I was really pleased that we were all able to come together and help support that project financially as well. Now, on the election law side of things, had a bill this year that dealt with the processing procedures for mail-in ballots, which is not necessarily the most glamorous thing, but coming up on an election, of course, one of the things that I'm very proud of is that while around the country, we've seen voting rights restricted and chipped away at, in Maryland, we've really made a concerted effort over these past few years to increase the convenience of access to the ballot, right? Making it easier for people to exercise their right to vote. And with mail-in ballots and the growing popularity of mail-in ballots, I think a lot of folks wouldn't have necessarily opted for mail-in ballots were it not for the pandemic in the 2020 election. But after folks saw how convenient and easy it was, and that it worked smoothly and is an easy option, they're very popular, and we're seeing the Board of Elections is already seeing huge numbers of requests for mail-in ballots. As the number of mail-in ballots grows and the proportion of votes cast by mail-in ballots grows, it changes the way the Board of Elections processes the ballots. Typically, pre-pandemic, when mail-in ballots were relatively rare, they weren't even looked at to start processing. The envelopes weren't even dealt with until after Election Day. But given the pandemic, there were emergency regulations to allow for processing to start before Election Day, just because of the sheer volume of mail-in ballots. And the bill that we passed this year essentially codifies the practices that were put in place, with a few tweaks, but largely codifies the practices that were put in place under the emergency regulations during the pandemic. And one of the important pieces of that is a ballot curing provision. So one of the things that's important to know, and if you're planning to vote by mail-in ballot, let this just be a reminder, you do have to sign the oath on the outside of the envelope, right? If you don't sign the oath on the outside of the envelope, the ballot can't be counted. So if the Board of Elections receives a mail-in ballot and the oath isn't signed, they now will attempt to contact the voter so that the voter has a chance to correct that before the ballot has to be counted, or if it's not cured, rejected. So for anyone who's gone through the process of requesting a mail-in ballot, you'll know part of that process now is giving the contact information and your preference for how to be contacted if there's an issue with your ballot. So we're really, doing everything we can to make sure that it's easy for folks to exercise their right to vote and that every vote gets counted. I think I'm probably over my time, so I'll stop there and get to questions.
Okay. Well, so I think if you've been listening closely, you should be impressed by the amount of work and the good things that have come out of this year's legislative session. And one of the things I will mention, that's because we had a record budget, right? There were a number of factors. Obviously, getting federal infusion of funds played a big role in our being able to patch some of the holes that were created during the pandemic, particularly money that was funneled back to state, to local jurisdictions to help them, for the monies that they had drawn on to pay for the early part of the pandemic. That's part of it, but we also saw some tax revenues that were a reflection of sort of the nature of our state. The mixture of business types and other interests that we have. And it really was a very good tax revenue year for us as well. That being said, we were able to put aside a record $2.4 billion in rainy day allotments. And I think what's important to all of us is we had about $650 million that we were able to put towards those programs that you've heard about, the child care programs and other things that we think really are value, quality of life issues. And many of those were things that have been underfunded for a long time. And that includes some additional money that we were able to put in for capital funding as well. So I'm going to just throw that background in there in case there are any questions. And if there are questions about that, that's all the only answers I have. So everyone else have to answer anything else about the budget. That I've said everything I know. Okay, so in terms of kinds of things that I did and we did on the Health and Government Operations Committee, some simple things. One of the bills that I was able to pass creates an in-state tuition status for people who are Maryland residents and then go off to the Peace Corps, because previously, as our laws would have it, if they were out of state for 2 years or longer, they were no longer in-state residents, and therefore they had to pay out-of-state tuition. And for Peace Corps volunteers who really are doing a great international service and service for our country and being paid small stipends, that really was almost a punishment for being willing to volunteer service. And so we were able to pass that out of both houses, I think almost unanimously. In addition, we passed a omnibus bill. I was able to get a billboard through that helps with our modernization of next generation 911 technology. And this bill really looks at our 911 specialists, who are the operators who answer the phones and make sure the dispatches are carried out appropriately and keep people on the phone and talk them through the crisis as they occur, that they're now being labeled as first responders. Previously, they had not been. We also made some changes on the board to make sure when board vacancies occur, that they're quickly filled. We gave local jurisdictions authority over the fees that they're required to raise to pay for the local 911 services and put in enhanced auditing policies to see how the fees are being collected and how they're being distributed to the local jurisdictions to make sure those costs are paid. And we also asked for a study, because what we do know in the past few years is that for most local jurisdictions, the 911 facility operating costs are not being covered. And we want to make sure that we have state-of-the-art 911 everywhere in the state. So no matter where you are, if you call for help, you can know that it's going to get there in a timely fashion. So we've done a couple of things with that. That being said, I think one of the most important things the General Assembly did that came out of my committee was to pass the Abortion Access Act, which does a couple of major things. It first of all broadens the health professionals who can be trained and certified and legally allowed to perform medical abortions or surgical abortions. It also creates training programs for people outside of the state so that they can learn how to perform a safe, effective abortion, because we know with the direction that many of the states are going in with the anticipated direction of the Supreme Court, that it's not only going to be more difficult for women to get abortions, but it's going to be really difficult for them to find qualified providers to do them. And that is a nightmare scenario that is a way of taking us back about 60 to 70 years. And finally, it removes the copayment from people on medical assistance that often delays them weeks and weeks from being able to have their abortions. And it actually puts them on par or gives them parity with women who have private insurance because they don't have copays when they have their abortions. So 3 really important things that we were able to do. In addition, we were able to do some things for veterans, including creating a post-traumatic stress disorder brain injury alternative therapy fund. And this is really important. It is taking a look at some of the therapies that are currently being experimented with, particularly using psychedelics that have shown some real advocacy or effectiveness in certain kinds of conditions like post-traumatic stress. These include medications like ketamine and psilocybins, and it allows the Veterans Administration to use funds to allow for research programs on our veterans and for our veterans so that they can have a better chance of getting the kind of help that they need. And we also set up a veterans advocacy and education program to make sure that veterans and their dependents are getting the kind of information they need to know what programs are available to them. When I talk about post-traumatic stress and I talk about that treatment, it reminds me of the issues that we're having with opioid abuse. And one of the things that we did with respect to that ongoing problem is to require the Department of Health going forward to use the state's integrated IT system, CRISP, to actually track opioid treatment medications so that we can have an ongoing idea of what medications are being used, what their effectiveness is, and really monitor their use and make sure that if there are any problems or if there's inadequate distribution or folks aren't getting the treatment that they need, that we can see that. And also if what we don't anticipate, but if for some reason we should see some abuse in that area, that we will have early alerts that these are problems to be addressed. So I'm gonna, those are some of the really important medically related bills that we did. And since I too, like Dr. Lamb, am a physician, those are some of the things that are really important to me that I wanted to speak to. But I think before I close, I'll also mention that one of the most important things we did as part of our government operations component on the committee is pass 3 pieces of legislation that really strive to address the problems that we have with security and cyber, to make sure that the state and all the local jurisdictions are meeting some base standards, that we have integrated connections and communications when cyber breaches or threats are found, and that there is real expertise and oversight in setting up our security systems and monitoring them amongst those. And those are pretty large bills with a lot of details. But after the hack of Baltimore City and Baltimore County school system and the state's Department of Health, it is clear that we are as vulnerable as any place else in the country, and we cannot afford to stay that way. So I'll leave it there and see where we go with questions.
All right, sounds good. So let's jump right into questions that have already been submitted up to this point. And just a quick reminder, if you had not had a chance to submit your question, you can still do so. There's a link in the YouTube description for you to use a form to be able to submit your question to us, and it is still being monitored. So first question that was submitted to us, and I think Delegate Hill touched on some of these pieces of legislation in her talk. The question is, how can Maryland help expand access to abortion for pregnant individuals traveling from states where abortion is banned or criminalized? Obviously, this has become a very real concern given the draft opinion that was leaked a couple of weeks ago from the Supreme Court, and something we'll look at this coming session. But open up to the team for any responses to this question.
I can jump in. I mean, I think Delegate Hill spoke about this. In my opinion, I think the Abortion Access Care Act was one of the most important things we did this session. Definitely, it is expanding access to abortion care is something that we already needed to do in Maryland, and the idea that many more states will have women leaving their home state to seek abortion care and likely coming to Maryland means that we need that expanded capacity even more. So I think Maryland is legislatively taking the right steps for folks who are interested in how you can, personally support folks who are coming to Maryland seeking abortion care, who may need help with expenses, travel, lodging while they're here. There are opportunities to get involved in helping in those ways. And if anyone wants to, contact our office, we're happy to share some resources for getting involved that way. I think there's also, a lot of concern about what might be happening in terms of what, I think we'll be looking at some legislation next session. I know several colleagues are already in conversation about it, about how we protect individuals in Maryland from, getting pulled into what may be criminal investigations in another state, and making sure that we don't have to, share information that would be part of those prosecutions, or have anyone bear any risk of being involved in those prosecutions in states where abortion may very soon be illegal.
I would sort of add to what Jessica was saying. One of the areas that will probably require us to take a really close look is the past several years we have entered Maryland in a number of healthcare professional compact arrangements. In fact, I sponsored the legislation that created the physician compact. We now have it for nurses and everyone else. And some of the things that happen with that is it says that if you are licensed as a member of a compact, meaning you're licensed in multiple states through a state-by-state agreement, if you are guilty or charged with an offense, in one state, it affects your license in every state, right? So, and there are some questions about if your behavior in another state could be interpreted by a state that you're licensed in, even though you didn't perform the act in that state, as being an issue. So if we have Maryland practitioners who are legally performing abortions, or frankly, the way, some of the laws that are being introduced in other states and passing in other states, look, even if you're treating a miscarriage, right, with a medication that can also be used to induce an abortion. If you do that in Maryland legally, does that mean that, Virginia, Mississippi, Ohio, wherever will now challenge your license there or potentially use that as a threat against you? So there are some complexities that go beyond what we're able to do in the state to make sure access is available, that really, I think, speaks to the autonomy of a professional to act within the standards and ethics of their profession, and how the imposition of laws will act upon that. And I'm sure Clarence has some thoughts, and Eric probably does too as well.
Yeah, I'll just add briefly that there was funding included in this year's budget to go towards training of abortion care providers. And that funding is already sitting there. It's already in the budget. And unfortunately, the governor has declined to dispense with those funds to be able to help support training of providers. I think all of us, or almost all of us, had signed on to a letter asking the governor to release those funds as allocated in the budget. Unfortunately, he's declined to do so. And so I think it leaves us at a little bit of an impasse when it comes to legislative tools, particularly since we're not in session, to be able to compel the governor to release those funds. But I think this really highlights the importance of this coming election when it comes to women's reproductive choices, and making sure that you have folks that represent you, that stand by your values. And so, we'll continue to advocate for releasing of those funds. We'll continue to work on that. I think one other thing that may be of interest for this next session, this coming session, is I know other states now have started looking at states that are more friendly to women's reproductive choices, are looking at ways to ensure that our law enforcement in those states are not enforcing the laws that are in some of the states where they're restricting access. And so, I'm not a big fan of pitting states against states, but unfortunately the Supreme Court seems to have left us in a posture where, we really have to defend, women's, abortion rights in our own state. And if that means, pitting us against other states, and that may very well have to be the case in the next session. So I think that's an open question as to how we'll tackle that in the next legislative session.
I'll just add that I'm pleased that we're in a state that's responsive to the myriad situations that women find themselves in when they're pregnant. This is not a one size fits all. I worry in other states, and I'm glad we're moving in the right direction, about a woman who miscarries and ends up being investigated because there's suspicion that she did it medically rather than a miscarry that would be under normal circumstances. A woman would already be dealing with the tragedy of losing a pregnancy that she may have been interested in having, and then to be considered a suspect, to have to, in those situations, a baby who is clearly not alive in the womb would not be allowed to be removed. The mother would have to carry it until she birthed it. There are so many situations, and I have a personal story about that, where a woman who got pregnant and the baby was no longer alive, the doctor determined it, did have the baby aborted. Obviously, it wasn't alive, and got pregnant shortly thereafter she had it. So I think about her son and how that particular person might not have come into the world had she not been able to move. And so there are just so many stories, and the situations are not clear cut, and they do not follow a specific pattern. And so we need to have a great deal of variability in women's ability to make these decisions. And I'm pleased to be part of a state that's moving in that direction, and continues to protect the autonomy of a woman, especially, like I say, given the variety of circumstances that exist.
Okay. So thank you for that question. Again, reminder, if you want to submit questions, there's a link in the YouTube description for you to do so. Our next question is, what will you do during the next legislative session to make sure that a bill providing Medicaid coverage for gender affirming treatment passes? I can take first stab at that and then see if others want to add on. There was legislation that was introduced on the Senate side by Senator Mary Washington, and I think on the House side by Delegate Ann Kaiser, called the Trans Health Equity Act. This would require the state's Medicaid program to reimburse and compensate for gender affirming treatment for trans individuals. And so both bills had hearings in their respective bodies. Unfortunately, they did not progress further than that. Neither bills were in my committee, but I think oftentimes these bills can take a few years to try to pass. And sometimes the biggest roadblocks are really the insurance companies and the payers. In this instance, given the nature of the topic, there may also be resistance from other socially conservative groups. But the intersection of those two stakeholders probably made it difficult to pass that bill this session. Although I'm guessing both sponsors will reintroduce those bills, and if they come to a vote on the floor, I would be happy to support those bills too. I don't know if Delegate Hill, do you remember anything about this?
So we actually did have the House version in our committee when we passed it out of committee. And I think that it failed to get a floor vote because the whip count indicated that it did not have enough support to pass the floor. Subsequent to the vote not being taken, it appeared that the reason there was not enough support is because there had not been enough discussion outside of the committee. And so members had questions that had not been raised, let alone addressed or answered. So people in the committee had a chance to vet the bill, to amend the bill, to come to a clear understanding of what was, what the parity issues were and what we were really talking about, that this was not about, forcing life-altering decisions onto, in a sense, pliant young people and children, and locking them into surgeries that could not be reversed, that it really, for the most part, didn't involve children at all, except for some hormonal therapies that are managed and have been managed for, frankly, decades, in a very professional manner for a number of issues, not just gender affirming treatments. So it became clear, and I think what will happen next year, if Delegate Kaiser reintroduces the bill, which I expect she will, is that there'll be a lot more discussion beyond the committee to make sure that people can get comfortable, and if they have concerns, that those concerns can be heard and addressed. And I think that makes sense. Again, as a physician, I looked long and hard at this bill. Some of the parity issues, there were questions that I had to look at because it talked about, coverage, insurance coverage without copay for some things that under a different diagnosis would be interpreted by an insurance company as being an elective, cosmetic procedure. But the reality is that the determination about whether something is elective or medically indicated is not simply based on what the procedure or treatment is. It is always within the context of what the diagnosis is. So, as a quick example, if I put an implant in someone's breast to make it larger, there are circumstances where that is purely a cosmetic procedure. But there are other circumstances with marked asymmetry, someone who's had a mastectomy, et cetera, where that is a medically indicated reconstructive procedure. So to talk about procedures and treatments that are appropriate for a diagnosis as medically indicated is very appropriate. And again, the fact that we're seeing states like Texas go not just in the reverse of this, but actually say that we're going to forbid gender affirming care to be done on children at all, from the same people who talk about the importance of parental rights over all health decisions of their children, including, whether or not their children can seek psychiatric care when they're suicidal, to whether or not they can seek, preventive medication because they're sexually active and don't want to get AIDS. Many of the same people in our General Assembly who don't want to give children that kind of decision-making with their physicians are at the same time, supporting legislation in other states that saying parents are not allowed with their doctors to make decisions about what is going to keep their child healthy and, frankly, in many cases, alive. So again, I think Maryland is standing on the right side of justice and on the right side of health, and we don't want a health system where the decisions about what you can and can't have are made by the government, who is sitting in your treatment room with you and your provider.
Okay.
Can I just
Go
really
ahead.
quickly,
Yeah,
I don't want
yeah,
to, let the physicians handle the medical treatment question, but I did just want to add, I have been in contact with Delegate Kaiser and confirmed that she does plan to reintroduce this bill next year. And I'm glad that's the answer, and I'm looking forward to supporting it next year.
Yeah, me too.
Great.
There's a lot of information there. There's very little I can add other than to say that this is something we need to support.
Okay, so I'm going to consolidate the next two questions because they both have to do with kind of an aging in place tax credit. The first question is, my husband and I have received an aging in place discount on our property tax bill for the past 4 years. We have lived in our same house since 1976. This year, we were informed that even though we were still, quote, aging in place, the discount has an expiration date. Why is that? And if you are encouraging the elderly to live in and maintain their homes, why would you withdraw the benefit? The second part of that from a different person is, will the nonprofits for our Aging Neighbors Act be funded in the coming fiscal year? On May 12th, the governor signed modifications to the Aging in Place tax credit, delegating broader authorities to county governments to tailor the program. The new act appears to retain the requirement that all residency be in the same house. However, there's a section of the act that allows the county to apply additional eligibility criteria. Do you believe this would permit a county to make the number of qualifying years portable, so to speak? That is, to not lose qualifying credits if the property owner downsizes. We have two folks from Ways and Means here. Maybe they can pick up
So
this question.
I'll start, and then Delegate Feldmar can do the more technical part because she's pretty good. A lot of the bills we pass that are tax bills are what we call enabling bills, because oftentimes we're passing a tax that would cost a county money. And so we don't require them to implement those tax changes, but we do enable them to, because we have to do that at the state level. And this is a bill that we've been working on for some time to allow counties to do it. So I would say in general, I'd have to read the bill to be sure, but I believe that counties are enabled. So I hate to punt, but this is a case where we need to ask the county government this question if they're changing the circumstances. And Delegate Feldmar, if you can comment, I don't think we did anything to tighten the restrictions on, but if we did, that might have slipped by me.
Sure. So I think the intent is still for it to apply to the property that someone has been in for many years, right? And I think that this is I know it has been a challenge for a lot of folks who say, want to downsize, but can't sort of take the tax credit with them. And downsizing in size does not always mean downsizing in price, right? So I think that I understand that concern. I don't believe the ability for the county to add additional criteria. That's generally the county can add criteria to narrow the tax credit, but not to broaden its applicability. So happy to take a closer look at that and confer with the AG's office just to make sure that my read is accurate. But we can certainly follow up on that offline. I do know that has been a challenge for a lot of folks who have enjoyed that and are now reaching the end of what was that 5-year sunset. So there is there is now the authority for counties to reconsider that, and I think in terms of criteria, income eligibility is probably something that is a likely criteria for consideration.
And I think in that aging in place question, there was a quick question about legislation I passed, the NANA Nonprofits for Aging Neighbors Act, and whether Governor Hogan would be funding it. So, the first year we passed the legislation, it was not funded. The next year we passed legislation requiring a minimum of $100,000 a year. We put a mandate on it. The governor vetoed that. We overrode the veto. So he should be, or the next governor should be putting it in their budget. I don't think we'll, certainly I hope we'll have a Democratic governor the next time, so we won't have to have these battles over such important issues. But there is it's a mandated budgetary minimum, and it should be in there.
Okay, seeing no other responses, we'll move on. Next question has to do with the Easy Pass program. So it says the legislative oversight is definitely needed for the Easy Pass programs. It is difficult to deal with them and they are incapable of correcting mistakes. I can take first stab at that. There was an audit that was done by the Office of Legislative Audits last year that reported back to the Joint Committee on Audits that I co-chair. And we held a hearing about the Easy Pass program. To be honest, it's been a complete debacle since the pandemic has started. There have been many drivers, thousands of Maryland drivers that have been improperly billed as a result of changes that took place at our toll facilities that are run by the Maryland Transportation Authority. During the pandemic, they switched to cashless tolling and brought in a new contractor to manage the program. Unfortunately, there was very poor oversight and management over the contractor. And as a result, we heard from thousands of drivers that some of them had experienced a couple $1,000s in late fees, even though they had easy passes and really some of the machinery was not picking up as they were driving through the toll booths. The audit that the state conducted found that this was really just probably the tip of the iceberg. They did a sampling of charges that the Transportation Authority had billed to consumers and to drivers, and in all likelihood, there are many more mischarges that took place. On top of that, the Maryland Transportation Authority didn't have adequate customer service agents to be able to answer the phones for customers who felt that they were misbilled. And so they, I think at some point in time, had only about 82 agents handling about 15,000 calls a day. and simply couldn't handle the volume. And so on one hand, individuals were being mischarged, and on the other hand, there was almost no way for them to get it corrected. So we did pass legislation in this past session, several bills actually, that have taken effect and will allow drivers that believe that they've been mischarged to be able to clarify their charges and their payments without any penalties through November 30th of this year. And so I know the Joint Audits Committee will be vigilant and stay on top of the Maryland Transportation Authority. And I think the Office of Legislative Audits is going back in there to make sure that the state is properly accounting for these mischarges and making the corrections that need to be done. And we'll continue to look at that over the coming months. But folks do have a ability to get this corrected and to pay anything that they need to pay to the state without any penalties through the end of November. Anyone want to add anything to that?
Just that we have crack staffs, and if you're having trouble personally, contact us. We can get things straightened out with Easy Pass. It's unfortunate if you have to do that, but until things clean up, if you send something to our staffs, they're very good at, amending, fines and all that sort of thing. If, usually if you've driven through, you still have to pay something because you drove through. But if you're being fined exorbitantly or even at all, we can usually get that taken care of.
Okay. I think we're down to the last two questions, and then we'll go ahead and try to wrap it in a few minutes. This next question is coming in from Catonsville. And the question is, would you please comment on the recent quote unquote master scam by the Hogan administration to sell Spring Grove for $1 and to leave 300 mental health patients without a residential treatment facility, and also to abolish the Maryland Department of Health offices for 2,000 state workers. This is referring to what took place, I think, last or 2 weeks ago before the Board of Public Works, where the state has decided to lease the old Spring Grove Hospital facility to UMBC for $1 a year for the next 10 years. And this person obviously has some concerns about, the transfer of the facility to UMBC and also the mental health patients that still continue to need facilities.
So there are a bunch of concerns on this one. Actually, I think UMBC takes possession and leases it back to the Department of Health for $1 a year, if I have it correct.
Yeah, that's correct. Sorry, I had it first.
Yeah. So, in the big picture, there's a very valuable piece of property that's not being used very well. There's been a lot of interest in it from a lot of quarters for a long time. And Catonsville is understandably concerned about how it be used. On the face of it, having a major university, a public university, be the steward of that property is probably the best going forward in the future. Now, that said, UMBC acquired this property without providing a great deal or very little, actually much detail at all about their plans for it. We've seen plans as a group. We've gone and visited UMBC and seen their plans, and they're varietal, to be sure, but they can change them. And the idea is that they will probably, although there's no guarantee of this either, lease this back for 10 years at least while they come up with a plan and while the Department of Health also comes up with a plan for the other problem that exists. But it will now be incumbent upon us, and in some ways me a little more than the other three, since I'm in Baltimore County, to keep a weather eye on what UMBC's plans are and to make sure that they're public and they're vetted and that they are not only beneficial to the university, but beneficial to the community at the same time. UMBC has to be a good community partner. And they have been up to this point. So there's reason to believe that they would come up with a plan. But again, this sale happened a little suddenly to us. We knew it was coming, but we weren't quite aware how quickly it was going to take place. And so we are certainly not suspicious, but we certainly are going to be careful about what happens to that next, to be sure that it fits in with the plan for the community as well as the university. We have a number of people in the community who are quite adept at these kind of things, and I want to cooperate with them to be sure. UMBC is in District 12. As it stands now, the Spring Grove property isn't. Um, Neither of them will be in my new district in Baltimore County. But as I've said to everyone, just because you have a district doesn't mean that you don't care about other parts of the community. Certainly to be parochial and say it doesn't matter to me. I'm going to take an active role in concerning ourselves. What I'm going to do now is I'm going to say we have another problem. Once the Department of Health begins to close this hospital down, and that is the long range plan, 10 or 20 years, the question is what happens to the patients there. Most of the patients there, about 90% of them, is my understanding, are forensically assigned there. And that means that they're criminally, you would call them criminally insane. They're not found guilty by reason of insanity, but then they have to spend time getting help. So they're not really there voluntarily, and they need help, obviously. And so the question becomes, what happens to those patients? What's the plan? And that's where we have to watch Department of Health and see what they're planning to do next as well. And then lastly, if they're closing this facility down, there's a lot of jobs that belong to people who work very hard in those facilities. And there's a lot of concern about lost livelihoods for those folks as well. So I've talked about the property and my concerns about the property in the community. And I think I'm going to hand it off to someone else to talk about what they're concerned, how they might think that we keep an eye on concerns about patients, because actually we have doctors in the house, but that doesn't mean you can't answer.
Yeah, Eric, I'm glad you mentioned the Department of Health. So first, I mean, agreeing with everything you said, this is the same thing that the administration did with Rosedale, I guess about 7, 8 years ago. And I know that one of the first tours that I guess the three of us, Eric, Clarence, and I had when we first took office was we met with then Secretary Van Mitchell over at Spring Grove, and he wanted us to understand how a facility of 150 years of age with walls that in some cases were 10 feet deep, right, or 10 feet wide. I mean, deep meaning that you couldn't put the kind of electronics, Wi-Fi, connectivity, the things that you need to run a state-of-the-art healthcare facility was really challenging. And so it's always had this overlay of what does the community want? Folks who want, more open space, folks who want to see, retail, and that was obviously a big push a decade ago from some interest. Folks who want to make sure that it continues its health mission, and it really is complex. The only piece that I feel good about the announcement is I do think that UMBC is a good steward and a local steward. But I do think we have to keep an eye on what kinds of solutions the Department of Health will come up with. Secretary Schrader simply, as I understood it, presented this as, oh, well, this is just the beginning of a plan. And it just seems to many of us that we ought to be a little bit further along than the beginning of a plan in this kind of time. So I think it was a way of sort of looking at the table that had been set 8 years ago and saying, oh, we still got this piece sitting here. Well, what do we do about that? And it sort of effectively just moved the whole thing down the road a little bit. That's just my thoughts, but hopefully optimistic.
Yeah, I'll just add briefly, because I know we're running short on time here, that, I share many of the same concerns, not only for the facility itself, but also for the patients that we already have a shortage of beds for forensic patients, and the mental health capacity is not great here in the state, and it's only going to be potentially exacerbated by this. I also share concerns about the employees that are there. I think there's a lot of anxiety amongst the employees that are still at Spring Grove, what this will mean for their future. So far, the state has tried to provide the assurance that nothing is going to change, at least in the near term. For the next 10 years, there's going to be this buyback from, or lease back from UMBC for the state to continue to use the facility. And I think there's another 5-year option beyond that. That said, I would have preferred to have a plan in place before this was all moved forward, and it seemed very hasty to me. Under this administration, doesn't look like there was much pre-planning that went forward on this, except to say that we want to move this in this direction. And it will, in all likelihood, be left up to the next administration, the next secretary, to figure out how to answer all of these really challenging questions. So I think more to come on that. All right, so I think we're down to our last question here. And I know there were some questions that were submitted by someone in Catonsville on Roe versus Wade. I think we touched on that earlier. There was also a question on standards of care for assisted living. Unfortunately, I don't think we will get to that one, but we will make sure that our staff follow up with that individual who asked that question from Charlestown with an answer by email. The last question I think that was submitted that we will be able to get to also comes from Charlestown. And the question is this: we're going to miss having this great team of legislators here in Catonsville. Thank you all. What is the status of required civics classes with the unified curriculum in Maryland? Also, do you think that new citizens should automatically be registered to vote? I will just kick it off by saying, I know we touched on this earlier. We will certainly miss having Delegate Ebersol as part of this district. The changes are to the district. The changes that are taking place in the district will split District 12 into two sub-districts, a 12A sub-district, which will remain in Howard County, and a 12B sub-district, which will go into northern Anne Arundel County. And what we're losing then is the southwest part of Baltimore County that used to be part of District 12. That part of the district will be divided between District 10 and also District 44. District 44 will have two sub-districts, A and B. And so a lot of changes taking place. Encourage folks to really look at a map to understand where you'll be. I think to the questions, I think all of us support generally making it easier for people to vote. And we've certainly supported policies and legislation that will expand people's ability to register to vote, to have access to the ballot, and will continue to do so as well. And so, let me turn it over to the others who may want to answer these questions too.
Since I'm hoping to represent Charlestown in the coming year, I'll go in on that one. We have been a really good team, and the folks at Charlestown certainly have expressed their appreciation. You might have, if you watched tonight, you saw us each take answers where we have areas of expertise, something that I've always appreciated a great deal. Just because I'm not in the district, these people doesn't mean my friendships will die with them while I'm representing that part of Baltimore County. I will turn to these folks to help me understand issues that are not the ones that are front and center in front of me all the time in the legislature, but the ones that are front and center in front of them, including elections and taxes, which Delegate Feldmark is very good at. Delegate Hill and Delegate Lamb both, and sorry about that, Senator, and Senator Lamb both have great expertise, not only in the medical field, but that is one where certainly I can use their advice. And so they're gone, but not forgotten, and their skills will not be right in front of you, but they will still be used by me a great deal.
I'm going to say this, and if I don't know if Phil's on the phone or not, it has been a privilege to represent Baltimore County. And I know that District 12 being a Baltimore County, Howard County district precedes us. It was a 12A before when Jimmy Malone and Steve DeBoy and Liz Bobo served under Ed Casemeyer. So this is a huge change for the residents of District 12, particularly in Baltimore County. I particularly appreciate the relationship with Charlestown because of your interest, your advocacy, your experience, your great ideas, and your willingness to embrace us and to work with us. And Phil had sent a question before the maps came out about, was it true? And I didn't know how to answer. I didn't know that was the direction things were going, and I hadn't been listening to the rumors. And it was just too difficult for me to write a letter back. I still have it in draft. That being said, I think one of the cool things is having, assuming she's reelected, as we're all hoping and assuming will be reelected, I think having the speaker have her district come back down into Southwest can only be an additional boon for Southwest. And there's some really great possibilities there. And the folks we've been serving with as the Catonsville 7, including Charles Sidner and Pat Young and Sheila Ruth are terrific. And so we'll still be rooting for y'all and supporting you in any way we can as we get to know our new constituents as well. So that's all I wanted to say. I wanted to thank you all, and hopefully there'll be some other opportunities before my current term is up to visit with you guys again. I know I'll be in Baltimore County for some other events as well. So I just wanted to add that.
Well, I'll jump in and actually want to, before I talk about the redistricting and the changes in representation, want to touch on the specific questions in terms of civics curriculum. There is in the legislature, I think folks know, generally a reluctance and hesitancy to get into legislating curriculum. It's sort of the rare exceptions where we would do that. And I think this is something that can and should be an ongoing conversation with the State Board of Education and with your local Board of Education. So just to address that, I don't anticipate, it's possible, but I don't anticipate any legislation unifying civics curriculum, just simply because of that standard that we don't want to get bogged sort of down the rabbit hole of legislating specific curriculum. And on the question of automatically registering new citizens, I think that option would be wonderful, right? Like I wouldn't want it to be an automatic and new citizens have to register and other citizens can choose whether or not they register. That doesn't quite seem right, but to have the option of automatic registration, I do think would be wonderful. And I would certainly, certainly support that. I know one of the things that we have done is worked with having, voter registration available to new citizens as soon as they complete their ceremony, their naturalization ceremony. So then I will say it is sort of bittersweet as we prepare for redistricting, and it has been wonderful to represent Southwest Baltimore County. Getting to know that part of our district has been enriching, and I really appreciate how engaged constituents have been. I will say this. Even if I don't represent you, it doesn't mean I don't want to have a conversation with you, right? So please don't hesitate to reach out. I know I've enjoyed your perspective and input on a lot of issues, and hope that those conversations will continue, even if I'm not on the ballot when it's time for you to vote for your delegate. So, appreciate that relationship and look forward to continuing it, even though I won't be representing Baltimore County anymore.
All right. Well, thank you for tuning in tonight. I think even though Terry, Jess, and I won't be representing Southwest Baltimore County in the future, we still currently do represent you, and we'll do so until Election Day. Or at least until the new individuals are sworn in January. And so you are always welcome to reach out to any of our offices. We have a great working relationship between our offices to share constituent concerns. And so don't hesitate to reach out. If we can still be of any assistance, we will still be here to serve you. We'll continue to do so as well. It's been really a lot of fun and a pleasure to work with Eric over this is, I guess, going to be the 8th year of our town halls, and I guess the last, but It's been a lot of fun. And so we appreciate having Eric here. I want to acknowledge and thank the staff for, supporting this event and helping make it happen. We have Ayanna Harrison from Delegate Hill staff, Katie Malone from Delegate Ebersol staff, and we have Katie Mettle from Delegate Feldmark staff, and then from mine, Aaron Mansour, as well as Chris Daniel, who helped support and make this event happen as well. And with that, Eric, do you want to have the last word?
Just
looks like
yeah,
you're
just
itching
one
to have
last
the
thing.
last word.
We've
Go
been
ahead.
focusing on how you're all going to be gone from Baltimore County and how much you're going to miss that. Let me be clear. I'm very sad to be leaving Howard County also, but still find myself accessible to them at the same time in Riverside. I know you've got so many good people there, but I'm still around too. And I certainly, after years of teaching in Howard County, I feel as if that's almost a place of residence for me. So I'm certainly sad not to be representing there.
And you're still their delegate to January too, aren't you, Eric?
That's what I mentioned that. I said, yeah, I'm still the guy. I'm one of the guys.
All right. Well, obviously, we're all here to serve. And so don't hesitate to reach out. And then remember, Election Day for the primary is July 19th. You have a lot of choices ahead of you and some very important choices to make. And so encourage you to remember to vote in the primary election that's coming up in just a few weeks. So with that, I want to thank you for tuning in and appreciate your time this evening. Have a good night.